Excessive urination, medically known as polyuria, is a condition characterized by an abnormally large production of urine. While it's normal to urinate several times a day, individuals with polyuria find themselves visiting the bathroom much more frequently than usual, often producing more than 3 liters of urine in a 24-hour period. This condition can significantly impact one's quality of life, disrupting sleep, daily activities, and even social interactions. To fully understand polyuria, let's break down what is actually happening. Normally, your kidneys are responsible for filtering waste products and excess water from the blood, producing urine in the process. This urine is then stored in the bladder until it's expelled through urination. In a healthy individual, the body regulates urine production based on factors like fluid intake, blood pressure, and the body's hydration status. However, in cases of polyuria, this delicate balance is disrupted. The body either produces more urine than normal or is unable to concentrate urine effectively, leading to increased urine volume and frequency of urination. Causes of excessive urination. There are numerous reasons why someone might experience polyuria. Here are some of the most common causes. Number 1. Diabetes. One of the most common causes of polyuria is diabetes. Both type 1 and type 2 diabetes can lead to polyuria. When blood sugar levels are high, the kidneys work overtime to filter out the excess glucose, drawing more water into the urine in the process. This results in increased urine production and frequent urination. Number 2. Diabetes insipidus. Unlike diabetes mellitus, diabetes insipidus is not related to blood sugar levels. Instead, it's a condition where the kidneys are unable to conserve water due to a deficiency of antidiuretic hormone or a lack of response to antidiuretic hormone. This leads to the production of large amounts of dilute urine. Number 3. Hypercalcemia. Elevated levels of calcium in the blood, a condition known as hypercalcemia, can affect the kidney's ability to concentrate urine, leading to increased urine output. Number 4. Kidney disease. Various forms of kidney disease can disrupt the kidney's ability to filter blood and regulate urine production. This can result in increased urine output as the kidneys attempt to compensate for their impaired function. Number 5. Excessive fluid intake. Consuming large amounts of fluids, especially those containing caffeine or alcohol, can increase urine production. Caffeine and alcohol have diuretic effects, meaning they stimulate the kidneys to produce more urine. Number 6. Certain medications known as diuretics or water pills, increase urine production. They are commonly prescribed for conditions like high blood pressure, heart failure, and certain kidney disorders. Diuretics work by helping the kidneys eliminate excess sodium and water from the body, which can lead to polyuria. Other medications, such as lithium and some calcium channel blockers, can also cause polyuria as a side effect. Number 7. Pregnancy. During pregnancy, the body undergoes significant changes, including an increase in blood volume and kidney filtration rate. This can lead to more frequent urination, especially in the first and third trimesters. Number 8. Neurological disorders. Certain neurological conditions, such as multiple sclerosis or spinal cord injuries, can affect the nerves that control bladder function, leading to polyuria. Number 9. Prostatic hyperplasia. In men, an enlarged prostate can cause incomplete bladder emptying, leading to more frequent urination. Number 10. Urinary tract infections. While UTIs typically cause frequent urination rather than increased volume, in some cases, they can lead to polyuria. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of excessive urination. The primary symptom of polyuria is, of course, frequent urination. But how does this actually feel for those experiencing it? Well, this means having to urinate more often than usual and producing larger volumes of urine each time. This can be particularly noticeable at night, a condition known as nocturia, which can disrupt sleep and lead to fatigue and other related issues during the day. Also, with this increased urine production, your urine often becomes more dilute, appearing clearer than usual. People with polyuria might also experience increased thirst as the body attempts to compensate for the loss of fluid by signaling the need for more water intake. This can create a cycle of drinking and urinating that can be quite disruptive to daily life. In some cases, polyuria can lead to dehydration if fluid intake doesn't keep up with the amount of urine being produced, resulting in symptoms such as dry mouth, dizziness, and fatigue. Diagnosis of excessive urination. To diagnose polyuria, your doctor will ask about your fluid intake, urination patterns, and any associated symptoms. They might also inquire about any medications the patient is taking and any relevant medical conditions, such as diabetes or kidney disease. To confirm polyuria, doctors typically conduct a 24-hour urine collection test, where the patient collects all urine produced over a 24-hour period. This helps quantify the total urine output and determine if it exceeds the normal range. Blood tests might also be performed to check for underlying conditions such as diabetes, kidney function, and electrolyte levels. Treatments for excessive urination. When it comes to treating polyuria, the approach depends on the underlying cause. Here are the primary treatments. Number 1. Diabetes management. If polyuria is due to diabetes mellitus, the focus is on controlling blood sugar levels. This may involve medication, such as insulin or oral hypoglycemics, dietary changes, and regular exercise. Proper diabetes management often resolves polyuria along with other symptoms. Number 2. Adjusting medications. If polyuria is a side effect of certain medications, doctors might adjust the dosage or switch to a different medication. For example, if diuretics are causing excessive urination, the doctor might lower the dose or prescribe an alternative medication. Number 3. Reducing fluid intake. For cases where excessive fluid intake is contributing to polyuria, patients might be advised to reduce their consumption of fluids, especially those containing caffeine and alcohol. Try to limit your caffeine intake to less than 100 milligrams per day. Generally, it is recommended to drink about 2 liters, or approximately 8 cups, of water a day, unless advised otherwise by your doctor. Number 4. Treating underlying kidney disease. For polyuria caused by chronic kidney disease, treatment focuses on slowing the progression of kidney damage and managing symptoms. This might involve medications, dietary changes, and in severe cases, dialysis. Number 5. Medication for diabetes insipidus. For central diabetes insipidus, synthetic vasopressin or desmopressin can be prescribed to replace the missing antidiuretic hormone. In nephrogenic diabetes insipidus, treatment aims to address the underlying cause and may include medications like thiazide diuretics, which paradoxically reduce urine output in this condition. Number 6. Treating hypercalcemia. If high calcium levels are causing polyuria, addressing the underlying cause of hypercalcemia is essential. This might involve medications to lower calcium levels or treating the condition that's causing the elevated calcium, such as hyperparathyroidism or certain cancers. Number 7. Treating urinary tract infections. If a urinary tract infection is the cause, a course of antibiotics is typically prescribed. This usually resolves the infection and associated symptoms, including polyuria. Number 8. Surgery. In cases where an enlarged prostate is causing urinary issues, including polyuria, surgical interventions might be considered. At the end, it's crucial to remember that polyuria can be a symptom of serious underlying conditions. Therefore, anyone experiencing persistent excessive urination should consult a doctor for proper diagnosis and treatment. Remember, your body often communicates important messages through symptoms like these. It's up to us to listen and respond appropriately. Now we want to hear from you. Do you or someone you know have polyuria? What was the underlying cause of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.